Good morning. I see you are here for a cranial nerve exam. Perfect. I also see you missed the pre-check-in, so I'm going to just complete that right now if that's okay with you. Okay. So, let's get started. Just typing up your name. And can you confirm your date of birth? And I know you are a new patient. And who is your primary care physician? Okay. And so you were referred just for a basic cranial nerve exam. Okay, so no accident. Do you have any known allergies? Do you take any prescribed medication? And what are your symptoms? Okay, and so no symptoms, just a checkup. I'm just going to name a few though. Just let me know if you've experienced them within the past year, okay? Fever, extreme fatigue, weight loss, weight gain, unusual bleeding, headaches, any weakness or numbness. Have you fallen at all, lost your balance? Any difficulty falling asleep or staying asleep? Okay, and then any joint pain? Okay, and then I just need your emergency contact. So first name, and last name. And then phone number. Perfect. Alright, so we can get started. Are you comfortable? Perfect. So let's see. I think I'm going to start with your sense of smell. And so what I'm going to do is just take one at a time and just place the scent right under your nose. And you can let me know what you think it is. So let's start with this one. Okay. So scent number 1. Do you know what that is? Very good. That one is strawberry. Let's go to this one next. And what about this one? Very good. This one is peppermint. And some of them might be a little bit tricky, so if you have trouble, just let me know. Okay. Next one. Yeah, that one is kind of tricky, but you are correct. That one is lemon. It's a very light scent, so that's why it's kind of tricky. Let's go to this one. What do you think? Good, good. Yeah, that's kind of a tricky one too, but it is peach. Next one. Just 2 more to go. Good. That is bubblegum. One of my favorites. Okay, and then the last one. Alright. What do you think? Perfect. Watermelon. Another one of my favorites. Alright, so no trouble smelling these. Okay. Perfect. Now, taste test. So I'm just going to place 2 different drops on your tongue, one at a time. Just tell me what flavor it is. And again, you said no allergies. Okay. Perfect. Alright, so first one. One, 2. Yeah, perfect. So just a very sour, tart taste. Very good. And now this one. Again. 1, 2. So what do you think about that one? Very good. Alright. I'm just going to tape up a few notes from that part, okay? So, perfect. And you have not lost your sense of taste or smell in the past year. Okay, and have you ever? Okay, good. Now just a quick cognitive test to switch it up. So on this page right here, can you tell me how many red characters you see? And these specific characters are called Pikmin. So I'm going to bring it up close. Just count all of the red characters. Very good. 1, 2, 3. Let's see. 2, maybe 1 more. Alright. So for this one, can you just take your finger and start with one of these characters, and then just follow the line all the way to the corresponding item. Okay? So you can choose which one and go right ahead. So you did do it perfectly. And you didn't have any trouble comprehending, right? Okay, good. Very good. I think we'll move on to your eyes next. And remind me, no issues with your vision. Okay. So we're going to start with covering one eye at a time. Start with your right eye. Okay. And now just tell me when you see my finger wiggling in the background. Okay. Good. 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 Now the left eye. Same thing. Good. 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 So I just have some color sheets here, and I need you to tell me what color you see. And I'm going to just cover your eyes again, just like we just did. So cover your right eye again, and just tell me what color you see. Good. Good. Yeah, it's kind of like a turquoise. Now, same thing, but switching sides. So first color. Good. Second color. Good. And then third color. Good. Alright, so you did that very quickly. So no issues, right? Perfect. So now I just want to check your pupils just to make sure everything is reacting properly. So I'm just going to gently lift your eyelid. Does that hurt? Okay, good. Okay. Just gonna leave it there for a moment. Good, you can take a break and blink. I'm gonna look one more time. Good, good, good. Okay. Now your other eye. Okay, just hold it. Just gonna look in this one. Blink again. And I'm just gonna hold it again. Okay. And now look straight at my nose. Good. Good job. Okay. Now just follow this light with just your eyes. Good. Good. Okay, now I'm just going to lower the light a little bit. Alright. So I need you to first just look up for me. Just gonna hold your eyes again. Good. Very good. Okay. Now look down. Look to the left for me. Very good. I'm just taking a few notes, and then we will move on. We're almost done, and you're doing great so far. Alright, so I'm going to have you shrug your shoulders up for me. Good. Now look all the way to the left. Good. Now look all the way to the right. Any pain when you did that? Good. Now can you just roll your head in a circle like this to the right? Okay, now reverse and go to the left. Good. Now just stand up for a moment. Good. And just walk toward me. Perfect. Okay, you can walk back and sit down. So let's actually do your face movement next. So can you close your eyes for me? Now open them. Close them. And open them. Raise your eyebrows. And then bring them back down. Raise them again. And bring them back down. Okay, good. And can you yawn for me? Okay. Now stick out your tongue. And then just move it to the left. And then move it to the right. Okay. So for all of those exercises, did you feel any pain? Okay, good. So I was just testing your muscles, making sure nothing seemed abnormal. So now, similar to that, we're going to do your face sensation. Alright, so we will start with the sharper dull test. So the dull sensation you will feel is this cotton swab just brushed on your face. And then this is the sharp sensation, but don't worry, it doesn't hurt. It's just like a very light, prickly feeling. Okay? So close your eyes and let me know if you feel sharp or dull. Good. 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 Now, same thing, except we're going to do hot or cold. So here is the cold. And this is just a water globe that's commonly used for facials. Okay, it's a little bit cold. It was in the freezer. And then the warm will just be the touch of my hand. Okay? Alright, here we go. Good. 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 Okay. So any numbness? Okay. And you did not hesitate for any of those answers. So I'm assuming no challenges. So then just one more thing. I would like to just do a quick hearing test. So I will be using a tuning fork. Do you know what that is? Yeah, so it just makes a vibration sound. So I'm just going to strike it, put it on one side of your head, and make sure you hear it. So as soon as you hear it, just raise your hand for whatever side it's on. So I will need you to close your eyes. Very good. Alright, so first one. Very good. And now the second one. Very good. And then I'm just going to put it on the top of your head and just tell me if you hear the vibration in both ears. Alright? Very good. Alright, so no challenges. Perfect. Just typing up my final notes, but overall, everything is perfect. I don't see any signs of cognitive issues. Now, if you were to start having memory loss, start not comprehending things, or of course if you're in an accident, which hopefully you never are, but if you are, if you have any concerns about your cognitive function, please come back in. I think you're covered for one every year under your insurance, but if there's an issue, we can obviously get you in right away, okay? Now, any questions for me? Perfect. Well, I'm glad that you are in good health, and please give me a call if you need anything at all, okay? Alright, well, take care. Thanks for coming in, and I will see you next time. Good afternoon. I see you are my 1 o'clock appointment, is that correct? Perfect. Well, it's so nice to meet you. And I'm the doctor who will be doing your cranial nerve exam today. Now, I see you did have one a few months ago. Okay, and what's the reasoning for another one? Okay, yeah, no problem. And who is your primary care physician? Okay. Can you confirm your date of birth? Perfect. And just so you know, we are going to do this a little bit differently today. So I'm going to move through all of the tests without any kind of explanation, especially since you're already familiar with many of them. And then, let's see, any new medical conditions since your last visit? Okay. What about headaches? Vertigo? Muscle spasms? Any allergies? Any vision issues? Can you tell me where you are right now? Perfect. And can you tell me the date? Okay, good. Alright, so let's get started. Going to start off with some eye tests. Okay, so first up, I'm going to have you look at this light wherever I move it. Okay? So just follow with your eyes. cover your right eye. Just follow the light back here, okay? So just follow wherever it moves to. Very good. Perfect. Now we'll cover your left eye. Same thing. Follow wherever it goes. Okay. Now look right here. Very good. So now focus on this light up here and tell me when you see my finger. Good. 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 Focus again. Tell me when you see my finger. Good. 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 Now I'm going to have you close your eyes for me and tell me if the light is brighter here or here. Okay. Here or here. Here or here. Here or here. Okay. Now keep your eyes closed. Tell me if you think the light is in front of my hand or behind my hand. So here's the first one. Here's the second one. First, second. So is this in front or behind? Good. What about now? Good. In front or behind? What about now? Good. And now? And now. Very good. Now I'm just going to turn down the light a bit. Alright, so I want you to focus in the distance here where my finger is. You're going to see an orb with a light right in the middle. Just focus right there. Just looking at your eye up close. You'll see the orb move a little bit, and you can just follow it. Good. Now same thing over here. Just look in the distance. And just focus on it while I look at your eye. Just making sure I don't see anything. Just looking for any inflammation or signs of infection. Okay, good. I'm going to turn the light back up. Now when I say blink, I want you to blink, okay? Just going to look at your eyes as you blink. Okay, so blink. Good. Blink. Good. Blink. Blink. Good. Blink. 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 just want you to tell me what number you see hidden in this image. I'm going to bring it up close, move it a bit further back. Can you see the number? Very good. Here's the next one. Can you see this number? Good. And lastly, can you see this number? Very good. Perfect. Okay. So now I'm going to touch your face. Is that okay? Okay. So close your eyes. Just tell me if you feel it on the right side of your face or the left, okay? Good. 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 So now I'm going to try to open your eyes. Just resist it for me, okay? So don't let me open them. Okay, on the count of 3. 1, 2, 3. Good. One more. 1, 2, 3. Good. Now I'm going to try to push your head to one side. Same thing, just resist it. And you can open your eyes. 1, 2, 3. 1, 2, 3. Okay, perfect. Now I'd like you to touch your nose and then touch my finger. Alright? So nose, finger, nose, finger, nose, finger, nose, finger, nose, finger. Perfect. Okay. Now again on your face, just tell me if you feel something that is a little bit sharp or dull. Okay? So sharp, dull. Sharp, dull, sharp, sharp, dull, dull, sharp, sharp, dull, dull. Very good. Alright, I'm going to put a scent under your nose. Can you tell me what this smells like? Very good. And here's the next one. Very good. And now I will put a drop on your tongue. Just tell me if this is sour or sweet. Okay? So open wide. What do you think? Sour or sweet? Good, good. Perfect. So So now I need you to close your eyes again. I'm just going to make a sound and I need you to tell me when you hear it. Good. 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 Alright, you can open again. Alright, so lastly, just going to show you a few playing cards. And I just want you to repeat the order. Okay? So, here we go. Can you repeat that for me? Very good. This one, this one, this one, and this one. Can you repeat this for me? Very good. And one more set. Can you repeat this? Very, very good. Alright, so how are you feeling? Good. So yeah, that's kind of a quick cranial nerve exam. Since you just had one last month, I just wanted to pick out a few different tests that I thought would be the most important today. I didn't feel like you struggled at all. Did you feel like you did? Okay, so you weren't confused, weren't overwhelmed. Okay, good. Let me just write a few notes. And you passed every test, so no concerns. When was your last eye exam, though? Okay, yeah, make sure you go get your eyes checked. I did notice on your history here that it's been over 1 year, so just always want to make sure everything is up to date. Okay, so we did your eyes, your ears, your cognitive. And now are you interested in booking a next cognitive test? Yeah, we can definitely set you up for once a month if you want to do that. And do Wednesdays typically work well? 1 o'clock? Okay. So I can have the receptionist book you in for the coming months, no problem. And I will try to vary up the tests so we don't do the same thing every time. Alright, so this will be uploaded to your portal if you'd like to send it to your doctor, and then if you need anything, just let me know, okay? And of course, if you notice anything odd with your cognitive skills, so forgetting, vision issues, just kind of feeling abnormal, please let us know, okay? Perfect. Well, it was so great seeing you, and I will see you next month. How are you feeling? Good. I'm the nurse who will be checking on you this evening. Do you have any pain right now? Okay. So I just have a few questions to ask you, and then I will do a brief exam, okay? And your last exam was earlier this morning? Okay. And I'm sure you're hungry, so you haven't eaten since lunchtime, is that correct? Okay. Alright, so can you confirm your date of birth for me? Perfect. And I see you hit your head, and you're feeling okay. Medication is wearing off. And have you slept at all this afternoon? Okay, good. Have you felt like you've had any nausea? Any trouble breathing? Any dizziness? Any vision issues? Any feverish feeling? And what about any headache? Good. Alright, so like I said, I'm going to do a quick checkup, and then we'll get some dinner ordered for you and allow you to get some more rest. Okay? So I'm going to start off just by taking your temperature. Just want to make sure you don't have a fever. So I'm just going to place this right under your tongue. Okay, perfect. And we'll just leave it there for a moment. Very good. Okay, perfect. So no fever. So just relax for me, okay? Very good. Yeah, just breathe normal. Good. 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 Okay, now deep breath. Good. And another deep breath. And another one. And one more. And I see the doctor took your blood pressure this morning. Okay, so we'll take that again tomorrow morning. So I'm going to take a look at your wound first. I'm going to start with just examining it with a light. Alright, so just bring your head a little bit closer right here. Perfect. I'm just going to examine the wound. Turn your head a little bit. Good. Okay. So yeah, it does look like it needs to be bandaged again. And the previous nurse just removed the bandage, right? Okay. Perfect. Yeah, I wanted to be able to examine it and see if it's healing. Okay. So I'm going to actually measure it first, just to keep track of the healing process. I'm just going to get up really close. Just stay still good. Perfect. Just gonna get diagonal. Good. Okay, perfect. You can relax. So I'm just writing down the measurements. So now I will clean the wound. This might burn just a little bit, but we just need to make sure it's not going to get an infection. Okay. I'm going to get this done as quickly as possible. And you'll just feel the burning for a moment. Next, I'm going to just get some healing ointment. Just dab it on your wound. Again, this is really good for preventing infection. So I'm just going to dab it again. That doesn't hurt. So it looks good. And lastly, I'm just going to put a new bandage on. And we'll clean it again. At this point, probably tomorrow morning. Just gonna let it sit with the ointment and start healing. Right, so I'm just gonna stick it right there. Alright, looks good. Alright, so let me look again. And you said you have had a headache, obviously right where the wound is, kind of throbbing, right? Okay, yeah, we'll get you some more medication as soon as I'm done. Can you please move your head to the right? Good. Now move it to the left. Move it back. And then move it down. Okay, just checking your range of motion on your neck. Okay. And then I'm just going to place my hand on your throat. Can you swallow for me? Perfect. And just open your mouth. Open wide. Good. Okay, stick out your tongue. Move it from left to right. Good. Alright, now I do want to check your pupils. Do you have a sensitivity to light? Okay, good. So I'm going to have you just look right at this light. Good. Good. Okay, now follow this light. Good. Okay, now I'm going to just look up close again. Can you look up for me? Look down. Look to the left. Look to the right. Very good. Alright, now look right at my nose. Tell me when you see my fingers in your field of vision, okay? Good. 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 grab my eye chart. So I'm going to have you cover your right eye first. Okay. Can you read this line for me? Very good. What about this one? Okay. And now cover your left. This line for me. Good. And now this one. Good. And do you wear glasses? Okay, perfect. Just gonna make a note of that. Alright. Now tell me when you do not see this pencil anymore. Okay? So look directly at me again and tell me when you don't see the pencil. Good. 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 So I'm just going to hold up a few different colors close to your eyes, and I need you to tell me what color you see. So close your eyes for now, and when I say open, tell me what color. Okay? So here's the first one. Very good. Red. Alright. Eyes closed again. Here's the second. Very good. Black. Eyes closed again. Eyes open. Very good. Blue. So eyes closed. And now open again. Perfect. Eyes closed. And now eyes open. Perfect. Yeah, it's like a yellow green. Alright, one more. So eyes closed. Eyes open. Yes, a light blue. So everything with your eye health seems to be perfect. We always check that when we have a patient who hits their head. So I'm glad everything is looking good. Now I just have a few quick tests to check your sensations and then your cognitive skills. So I'm just going to ask you what object I'm showing you, okay? Alright, so what is that? And what color is it? Good. What is that? And what color is it? Good. What is this? And what color is it? Good. What is this? And how many legs does it have? Good. What is this? And what sound does it make? Good. And what is that? Very good. Alright. Again, we just check since you hit your head. I want to make sure everything's okay. Alright, so now just double checking your sensations. Just want to make sure you can feel something that is sharp and something that is dull, and that you can differentiate between the two. So I will ask you to close your eyes, and I'm going to do the test on both sides of your face, and then also on both arms. Is that okay? Okay. So when you feel this side, you will say sharp, and then this side, you will say dull. Alright? So close your eyes. Good. 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 Now your right arm first. Good. 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 Now your left arm. Good. 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 Perfect. So I'm going to ask you to turn your head for me. I'm going to look on this side first. Okay. Everything looks clear. And you're not having any trouble hearing. Good. Let me come over to the other side. Good. Okay, so it looks good. When's the last time you had your ears cleaned? It's been a while. Okay. Yeah, I might have you get them cleaned soon if you can. But other than that, they look good. Alright, so like I said, I'm going to get you some medication. Okay. This will definitely help your headache. So I'm just going to set this by your bed, and you'll have to wait until you eat dinner to take this, okay? Alright, and what would you like for dinner this evening? So not really feeling like you have too much of an appetite? Yeah, understandable. What kind of sandwich are you thinking? Yeah, I think they have that. Alright, so chicken noodle soup, turkey sandwich, and then I'll find a sweet treat to bring you as well. I know they have really good chocolate chip cookies today. And I'm going to pass these notes along to the doctor, who should be in a few hours, okay? And this medication, again, will be taken with dinner, and it should help you feel better, okay? Perfect. Well, is there anything else you need at the moment? Alright, then I will just let you relax for a bit, and then your dinner will be up soon. So I'm glad you're feeling a little bit better, and I will check on you again later. So get some rest and feel better soon.